I'm Lorna Peacock from an organisation called CO2Sense based in Leeds. We were commissioned by NHS Leeds to deliver sustainability support to the Leeds CCGs. So this afternoon, Anne Frearson and myself are going to talk to you about the project. This is what we're going to cover. I'm going to just do a quick introduction on who we are and where we're from, give you some background to the project, talk about actually the project, what we did, the implementation options as part of the work we've done, actually the recommendations that we provided to the Leeds clinical commissioning groups, what we're actually doing now, putting it into action, and then the benefits that it's brought to these organisations. So as I said, I'm from an organisation called CO2Sense. It's a not-for-profit community interest company which helps businesses and organisations prosper in the low-carbon economy. We help large businesses, provide consultancy support to large businesses and public authorities. We also support small businesses through publicly funded activity and European funding, but we also have a unique part to the organisation because we have a not-for-profit investment fund. We've worked with the NHS in Yorkshire since 2005, so we have a well-established working relationship there. I'll now hand over to Anna, who will introduce herself and the project.
Hi there, I'm Anne Frearson. I work for the Primary Care Trust in Leeds, and I've had a dramatic haircut since that picture was taken. Actually, I just realised. I work in public health at the Primary Care Trust, and as part of the NHS reforms, the Primary Care Trust will cease to exist from the 1st of April. And its commissioning responsibilities will pass to 3 clinical commissioning groups in Leeds. So I really wanted to focus my energy into making sure that those clinical commissioning groups were going to take forward the work that I'd started in the Primary Care Trust and carry on the legacy that we'd set in the Primary Care Trust.
Oh, sorry, you better take it.
It's a bit of a double act, this, so bear with us. Okay, these are the aims of the project. And we really used the authorisation process for the clinical commissioning groups as a way in. There was something in there around sustainable development, and we used that as a way of sort of getting in the door. The response was lukewarm initially, but thanks to Lorna's good work, there's been a real change around. And the CCGs are very, very engaged now in this project, and Lorna's going to tell you about how she did that.
Great, thanks, Anna. Okay, well, the project, I suppose it's got 2 phases to it. There's a research phase, which I'll talk to you about now, and then there's the implementation phase, which I'll talk to you about in a few more slides. There were 3 steps in the research phase. So the first part was some scoping research to really understand what was required of the CCGs to get through authorisation, and then what was required of them once they were authorised. As well as that, it was also doing some desktop research to identify what guidance, support and tools were actually out there to pull it together into one place to make it as easy as possible for them to actually understand what their requirements were. As well as that, it was obviously engaging with the stakeholders, so with the CCGs themselves and partners to understand what their current thinking was on sustainability and what their ambitions were for the future, so that we could actually feed that into the plan and, I suppose, challenge them and get them to really say what they wanted to achieve as part of their sustainability activity. And partners that we engaged with also included organisations like the Sustainable Development Unit. Implementation options. There were a number of options which we identified through the scoping research and the stakeholder engagement. So these include a sustainability plan, a framework to actually help them through the process, cost-benefit analysis, and optimum decision-making. All of these activities and this research was brought together into one report which is publicly available. And if you're interested in getting a copy, take down our contact details at the end and we can send that out to you. So I'm just going to go through the implementation options that we identified for the CCGs, basically saying to them, well, this is what we think from the work that we've done and talking to you, these are the things you can actually do. So this was a sustainability plan, so these are the themes and options that we identified. Now, we used the NHS Leeds sustainability activity as a template for this. So instead of creating something totally from new, we've used that as a template, and some of that activity will be able to be moved across. Obviously, that also needs to be reviewed, so the aims, objectives and the actions within NHS sustainability activity needs to be reviewed, and also to make sure that it actually fits with the new requirements of these organisations. because obviously they are very different organisations. To actually provide structure to the sustainability plan that we had provided to the CCGs, we developed a framework. Now, this is a framework, I'd like to say it's a framework showing them where they can start, so on minimum requirements, on down to 0 there, level 0, right up to level 3, which we would say is an exemplar for an organisation of that type. Now, we weren't expecting them to say, right, yes, we want to be level 3 and we've got to do all this work and that's where we're going to go for straight away. I think if you think about it, it's actually a timeline along the bottom. So it is a journey, it's a starting point where they can identify where they are now and then where they want to be in the future. And this provides flexibility. So it provides them flexibility to move forward, see where they are and move forward. But it also helps them and provides a framework for them to actually embed sustainability from the outset as a new organisation. And it helps them to be able to respond to the emerging structure and requirements that are going to be coming out in the next couple of years within the NHS. So I think they found this really useful to identify where they are and where they want to go. We also developed a cost-benefit analysis, so linking to the sustainability plan and the framework, did a cost-benefit analysis for each of those levels. So it could actually quantify what they were going to do, how much investment that required if they were going to invest, what would the return on that investment be, what resources would they actually need to put into it. So it could actually weigh up what the options were and how far they wanted to go down the journey today. I also wanted to show the CCGs that, they have a real opportunity to embed sustainability from the outset, so that they actually won't be hindered by, I suppose, organisations who are already well established can be hindered by existing systems and processes that are in place. So I wanted to show them that, although things might be uncertain and, the structures are emerging, that they had to consider, or there's opportunity for them to actually consider things now so they don't actually get locked in to high running costs or high sustainability impacts in the future. So some examples that we provided to them, it might have been a new premises, for example. So they're moving into a new premises. Have they actually considered the sustainability impact of and the resource efficiency of that building? So actually thinking about it now and speaking to the landlord, making sure that they actually apply the sustainability requirements from the outset. Otherwise, they get locked in and won't be able to do anything about it for quite a long time. That's a very simple example, but I think it's also good to apply it to the commissioning and procurement. Okay, what contracts are going to be coming up? What should you be considering now? And how can you include sustainability as part of that? Provided a number of recommendations as part of this research. The first one, which I've mentioned already a few times, is about acting now. You have got a fantastic opportunity to embed sustainability from the outset and embed it into the culture of the organisation. Most organisations who are well established are hindered by systems and processes for actually implementing sustainability. The second one was to actually embed it from the outset. Next one was to include it in the commissioning plan. The next one was to include sustainability in the governance process. And the final one was to actually have a lead or a green champion in each of the CCGs. And I'm glad to say today that each of the three CCGs I'm working with actually have a board representative or leading on sustainability within the board, which is fantastic. So then on to the implementation, the actual action and the doing. And that's what we're doing now. It's important to say, I suppose, we're at the beginning of the journey on this. And I just want to touch on some of the things that we're doing at the moment. So we're finalising the sustainable development plans and tailoring them to meet each of the three CCGs' objectives. So that although they're working together, they might be slightly different because they might have areas that they want to focus on individually. We're also already started to implement some of the activity in the plans. So we've been into the premises before they, for example, office redesign, so they're moving into new premises. We're working with them to make sure they're as sustainable and resource efficient as possible. So, for example, in one of them, we've done a lighting review to make sure that they're making use of the most natural light in the building, but also providing recommendations of lighting that they could have, which will improve the environment, but will also be cost effective. Another thing that we're actually doing is a pilot with the GP practices in each of the CCGs areas. So we're working with between 3 or 5 GP practices and undertaking an intensive resource efficiency review and also a renewable energy feasibility study. The aim of this is to make sure that the practices are as sustainable as possible, resource efficient as possible, but ultimately help them to identify any cost savings that are available within these practices. And to tie all of this together, we are undertaking the mandatory sustainability reporting for NHS Leeds and pulling all of this activity together into one reporting activity. Now back to Anna to outline the benefits of the work that we're doing.
So a lot of the benefits are all grounded in the fact that we've got in early as these organisations are new and forming and developing. So acting now to prevent high running costs, ensuring there is going to be a focus on commissioning activity. We're able to set clear targets from the beginning. We're also able to meet statutory requirements and make sure we're set up to do that. And also things like maximising renewable energy opportunities. And that's really all centred around the fact that we've got in really early with the CCGs. There have been some challenges though, or there are some challenges ahead, which Lorna will talk about now.
Yeah, I suppose I'd like to say the work that we've done so far with these organisations, it is just the tip of the iceberg. I think the challenges and opportunities ahead lie within procurement and commissioning, because the CCGs are going to hold 80% of the NHS budget, and procurement accounts for 65% of the NHS carbon footprint. But that is a conversation for another day. As I mentioned, there is a report available in the work that we've done so far. So if you want a report or you want more information about the project that we're working on at the moment or just want progress on the report, these are our contact details, so please get in touch. But that's it from Anna and myself at the moment. We'd just like to thank so many of you for staying to listen to this afternoon, the last slot, and I hope you found it useful and informative. And thank you very much.